I was interested in UIC for a lot of different reasons, but one of them was the mission that UIC has to serve our underserved patient population. That was something that really spoke to me, and since training here and then choosing to stay on as faculty, I think is the best thing about UIC.
I was drawn to UIC really due to the mission of the institution. When I first arrived in Chicago, I was working at another academic medical center and was recruited up here by one of our faculty that's still here today. And I remember when I came, I was just amazed with how authentic the faculty were.
I have chosen to do a pediatric dermatology fellowship because I ultimately hope to work in primary care and integrate the knowledge that I have from this fellowship in order to help my patients with their skin conditions.
My experience with my MedPeds co-residents as well as my medicine and pediatrics co-residents has been great. Fitting in with the medicine side and the pediatric side has been seamless. Fitting in and being able to just be a medicine resident when you're on medicine and a pediatrics resident when you're on pediatrics has been so easy, and nobody treats us any differently, even though, and they actually look to our expertise as MedPeds residents whenever we have an older adolescent on pediatrics, or if we have somebody who comes in with a congenital disease on adult side.
My fourth year of medical school, I was able to go to Peru with faculty from the MedPeds program. We were trying to see if we could establish a project in that community, and in that capacity, we worked with not only doing like regular activities as in like journal clubs and whatnot, but really focused on working with a specific community in Peru throughout residency.
UIC definitely is one of those programs that I'm so glad I came to. The residency program here is so integrated both on the categorical sides. There is so much camaraderie.
This is the type of place that if a resident has an idea, they can bring it to the attention of the program directors, either the medicine, the MedPeds, or the PEDS program director, and then you can really bring that idea to fruition. It's not the kind of place where we say, oh, we've always done it this way, we're not going to do it that way. It's really a place that we're always taking feedback from trainees and always trying to make our program better.
What I would like for the applicants to take away is that UIC is a very welcoming institution. The residency program within itself is very warming, it's very welcoming. The residents, they have a bond that's not like no other. I mean, they truly do.
Additionally, it's not a very hierarchical place. I feel like for a big institution, for a big university, there's lots of ladders for people to kind of climb. So when you come here, you'll feel very welcoming. I feel that any resident or student feels comfortable approaching and attending or a faculty member if they have a question or if they want to work on scholarship with them. So there's just a lot of opportunities. So whether it be in research, in quality improvement, medical education, public health, global health, community health, whatever outlet you want to pursue, we have those opportunities, and we're here to support you and get you to where you want to be. We want to prepare you for whatever the next step is. The extracurriculars we offer and the clinical training we provide, you should feel prepared for whatever the next step may be.
You know, this is the family I've had as far as my professional career is concerned, and you know, and looking back, I don't know if I would do anything differently. So I think from day one, residents know to build a community because they are in the trenches together, caring for patients and being advocates and spending so much time here. And having trained here and staying on, many of my colleagues also trained and stayed on here, so I've been able to keep my family, so it's not like I had to adopt a new one. We're definitely able to bring our full selves to work, and I think that's when we get the best out of ourselves when we do that, and we're able to do that if we trust and can confide in one another.